All right, so the next section, we're going to talk about body movements. And this is kind of a fun one that you can actively participate in at your house, or you can just listen to me kind of go through them. So earlier, whenever I was going through the different types of synovial joints, I mentioned words like flexion and extension and rotation and so on and so forth. So now we're going to talk more about those particular movements. So we're going to subcategorize the way that synovial joints are able to move into either being a gliding movement, an angular movement, a rotational movement, or a special movement. And this table just summarizes the different types of movements and their definitions. So this is a good study table to refer to kind of categorize them all in your mind. So the first movement that we'll talk about is gliding. And gliding occurs when one flat or nearly flat bone surface is going to glide or going to slip over another one. So this type of movement is either going back and forth or side to side. So examples here would be the intercarpal and intertarsal joints, or between the flat articular processes of the vertebra. So the superior and inferior articular faucets, those also would be gliding movements. And so here's gliding movements showing the intercarpals. So in this scenario, you would be like waving your hand side to side, kind of like in that motion. And your tarsals are essentially, your carpals are just sort of sliding back and forth. Excuse me. The next type of movements are angular movements. So the sort of subtypes of angular movements are things like flexion and extension, which either decrease or increase in angle, abduction or adduction. So whenever I say abduction, I'm always going to refer to abduction as abduction so that it doesn't sound like I'm saying adduction or abduction. So I always say abduction and adduction. So you shouldn't be confused by which term I'm speaking, hopefully from this point forward. So abduction is moving away from the midline of the body, and adduction is moving towards the midline. And then finally, circumduction is just moving around an axis. So here's showing the example of flexion, extension, and hyperextension of the neck. So flexing is looking down, extending is looking up, and hyperextension would be looking all the way back. So flexion, here normally we sit in extension, and then hyperextension is looking up. In terms of the way that we can describe other areas would be, for example, bending forward would be flexing the vertebral column. Standing in a straight upright position is considered extension. And then when you're kind of like leaning over backwards, you're hyperextending your vertebral column. And if you hear my dog barking, I'm really sorry, but he barks all the time. There's just nothing I can do about it. So this is another slide showing you examples of flexion, extension, and hyperextension, this time of the legs and knee. So to flex the knees, when you would bend it, you're decreasing the angle. To extend the knee would be straightening it out from a bent position. And then to flex the shoulder, you'd be bringing your arm from this neutral position to the forward position. And then to extend the shoulder joint, you would be kind of pulling your arm behind your back, and the farther you can go would be considered hyperextension. The next three types that I had mentioned previously were abduction, adduction, and circumduction. So abduction, I mentioned to you before that this is moving the joint. This is a movement that's where you're moving away from the midline of the body. And so here, this side is an example of what I mean by like midline. So this would be midline of the body, and then you also have like a midline of your extremity, so midline of axial skeleton, and then midline of upper limb, and then you would also have a midline of your lower limb as well. But whenever we're talking about, maybe we're going to say shoulder abduction, we're going to start with our hands at our sides, and we're going to move our arm away from the body. That would be abduction, moving the arm away from the body. And then bringing the arm back towards the body would be adduction. And then circumduction is would be specifically of the shoulder joint, would be you're kind of in this abducted stance, and you're just moving your arm in circles. So the next movement would be rotation. And rotation is basically when you're turning a bone around on its own long axis, either towards or away from the midline. And there's a couple of different types here. So for example, medial rotation is where you're rotating the joint towards the midline. So medial rotation of the leg, essentially in order to accomplish this, you kind of have to like point your toes inward and kind of move your entire leg. You're sort of shifting your entire leg inwards, like your knee facing inwards and everything. And then lateral rotation, you're basically opening up your hips, kind of doing it the opposite way. And this would be medially and laterally, then rotating the lower limb. And then when it comes to rotating the head, we know that that's the shake your head no sort of situation. And that's the rotation that's occurring then between the atlantoaxial joint, the C1 and C2, or atlas and axis joint. So now let's talk about some special movements. I mentioned this particular movement earlier, supination and pronation. So supination is when if you're standing in anatomical positions, your palms are facing anteriorly. That would be considered supination. So you're holding a bowl of soup. Okay, you're holding a bowl of soup would be supination. And in this position, we can see that the radius and the ulna are actually parallel to one another. However, whenever we switch and perform pronation, which is basically taking that bowl of soup and dumping it out, we're going from holding the bowl of soup and then dumping out the soup. As we're dumping it out, the radius is actually going to rotate over top of the ulna, and at this point where it's considered pronation. Okay, so pronation is when the radius is going to rotate over the ulna, and supination is when the radius and the ulna are parallel and you're holding a bowl of soup. Another type of special movement that occurs at synovial joints are dorsiflexion and plantar flexion. So dorsiflexion is the act of, from a neutral position, you're pulling your foot upwards and you're basically bending your foot towards your shin. So if you kind of pull your big toe upwards and you're bringing your whole foot closer to your shin. And then plantar flexion is the position of taking your foot from a neutral position and planting your toes into the ground. Okay, so you're really pointing your toes, kind of like a ballerina sort of situation, this plantar flexion. Next is inversion and eversion. So inversion, in order to accomplish inversion, you start in a neutral position, and then you will move your foot so that the sole of your foot, basically the archway, is going to face medially, so it's going to face towards the middle side of your body, right? So a lot of people roll their ankles like this. This would be an inversion rolled ankle. And then the opposite of inversion is eversion, and so this is a much harder one to accomplish just because of the structural anatomy of the ankle itself. But in eversion, you're going to move your foot from a neutral position and then have the sole of the foot is going to try and face laterally. And like I said, eversion is kind of harder to do than inversion. Next is protraction and retraction. And so protraction of the mandible specifically is basically when the mandible is going to jut out and you give yourself an underbite. So that would be going from a neutral position to underbite position is called protraction. And then retraction is when the mandible is actually going to be pulled back towards the neck. And this would be like an overbite, would kind of look like a retracted mandible. Okay. Next would be elevation and depression. So the example that I have on here is of the jaw, but the shoulders also do elevation and depression. So elevation is just when you lift a body part more superiorly. So for example, whenever you have your mouth open and you shut it, you are elevating your mandible. Okay, so it's like, shutting it, okay? Also shrugging your shoulders, it's gonna elevate your shoulders. Opposite to that is the depression. So this is going to lower the body part. So for example, whenever your mouth is shut and then you open your mouth, you're depressing the mandible, you're moving it more inferiorly. And also by like lowering your shoulders, you can also depress your shoulders. This is a really special movement, kind of only really occurs in the thumb, but basically it's anytime that your thumb is like doing an opposing movement, so that's essentially where you're moving it across your hand. Any kind of grasping movement as you grasp onto, say, your phone, you're also performing opposition of your thumb. Or onto a cup or what have you. Okay, so clicker question. Pointing your toes downward is described as what type of movement? If you said plantar flexion, then good job. Remember, this is planting your toes like a ballerina.